Hi, I'm going to be doing my assessment. I just want to show you that my sheets are completely blank and there's nothing written on them. And I will be using this for my testing. Okay. And this is Katrina. She's going to be helping me out. All right, Ms. Larson, what are you here today for?
I'm just here for my yearly checkup physical.
Okay, I just have a couple questions for you, and I'm just going to ask you them periodically. So what is your general state in health right now?
Pretty healthy.
You don't have any complaints, any common cold or anything like that?
Nope.
Do you have any significant illnesses?
No.
Okay.
No.
Any previous surgeries or anything significant like that?
Nope.
Have you ever been hospitalized before?
No, I am not.
Okay. Any trauma like a motor vehicle
Nothing.
accident? Okay, good. Do you take any prescriptions?
I do not.
Any over-the-counter medications that you want to
Just
tell
an
me about?
occasional, like Tylenol here and there, but nothing.
Okay.
Yeah.
Good.
Nothing like that.
Any herbal treatments or medication?
Nope.
Okay. Can you tell me about your allergies if you have any?
I do not have any allergies.
Okay. Any seasonal allergies?
Nope.
Any food allergies?
No.
Insect, bees, anything like that?
Nothing like that.
Have you ever taken a medication where you've gotten like a reaction from?
I have not. No.
Okay. And are you up to date on all your immunizations?
Yes, I am.
Okay. Can you tell me a little bit about your family medical history?
Dad's side has a little bit of cardiac issues, but mom's side pretty healthy otherwise.
Okay. And then your grandparents, if they're still with us, they're healthy for the most part?
Yes.
Okay. And your brother has no
Nope.
health issues? Okay. No cardiovascular besides the one on your dad's side, anything
Yes.
significant you want to tell me?
My dad had quadruple bypass. So
Okay.
Just CAD.
Mm-hmm. Any family history of cancer or anything?
No.
Okay. Can you tell me where you work?
I am a nurse at the Cleveland Clinic.
Okay. And what do you like to do for fun?
For fun, like to just relax in my downtime, especially being nurse is a high stress job, so just relax and things like that. Like to work out.
Do you have any stress factors other than work?
Nope.
Okay. And who would you say is your support system?
Family and close friends.
Okay. And then as far as health-related factors, do you smoke tobacco or cigarettes?
I do not know.
Okay. And as far as drinking based on the age group, how much do you think you drink in a week?
In a week, probably like 1 to 3 drinks a week, if that.
Okay. And then other social drugs, do you think you take part in?
I do not know.
Okay. Do you think you have any environmental risk? Do you live with anyone that smokes cigarettes
I do not know.
or do drugs?
No.
Okay. Have you ever been involved in domestic violence?
I have not.
Okay. Any sexual violence?
No.
Okay. Do you feel safe in the home that you're living in right now?
I do, yes.
Okay. And have you ever been abused sexually?
No.
Okay. Can you tell me a little bit about your diet?
Diet, so I don't eat any meats.
Okay.
I'm a vegetarian, but I do eat occasional seafood, so things like that. It's tough, but I try to limit the amount of carbs I intake too.
Okay. And what about your exercise?
Exercise, I work out probably like 3 times a week.
Okay, good. Any recent or extended travel?
No.
Okay. And then I just have a couple of questions, kind of going generally from your head to toe, and just answer appropriately. So do you have you been fatigued lately?
I've not, no.
Any malaise?
No.
Any dietary changes you want to tell me?
No, the whole vegetarian thing, it's been about a year since I made the change. So, in the beginning it was a little tough, but now I think my body's totally adjusted to it.
Okay. Any change in weight, but aside from working out and trying to lose weight?
No.
Okay. Any change in texture in your nails or your skin?
No.
Or your hair?
No.
Have you lost hair or grown hair in an abnormal way?
No.
Okay. Any tendency for bleeding or bruising?
Nope.
Okay. Any changes in your moles or any freckles that you might have noticed previously?
No.
Okay. Any dizziness?
No.
Any headaches?
No.
Any history of head injury?
No.
Okay. As far as your eyes, any double vision?
No, I wear contacts.
Okay. Any blurriness when you are wearing your contacts? Okay. Okay. I'm happy about that. Vision. And then when was your last eye exam?
It was June, July-ish.
Okay. As far as your ears, any tinnitus?
No.
Any vertigo?
No.
Any discharge or ear aches?
No.
Have you had any sudden hearing loss?
No.
Okay. For your nose, any allergies? You told me no allergies.
No.
Any rhinitis?
No.
Any trauma to your nose, like if you've broken your nose or deviated septum?
No.
Okay. Have you ever had a bloody nose spontaneously?
No.
Okay. For your mouth, any loose or broken teeth?
No.
Any hoarseness?
No.
A sore throat?
No.
Any tongue pain?
No.
And when was your last dental exam?
Earlier this year.
Okay. For your neck, any neck stiffness? Any goiters that you've noticed?
No.
Any lumps?
No.
Any swollen glands?
No.
Okay. For your breast, do you do self-examinations?
Yes.
Okay. Have you ever received a mammogram before?
No.
Okay. Any lumps there?
Nope.
Any pain or discharge that are abnormal?
No.
Okay. Do you have a cough currently?
I do not, no.
Okay, if you do cough, do you usually cough up any sputum?
It just depends, like if I have like a little seasonal cold or whatever, but I just kind of got over a cold a couple weeks ago and there was no sputum with the cough, so.
Okay. Any difficulty breathing?
Nope.
Any pleural pain?
No.
Okay. Do you have any chest pain right now?
No.
Do you have any shortness of breath?
Nope.
Have you noticed any palpitation or murmurs?
No.
Okay. And when was your last EKG?
I've never had one.
Okay. And no syncope?
No.
Do you get dizzy when you stand up at all?
No.
Okay. Any nausea, vomiting?
No.
Any changes with your appetite?
Nope.
Any rectal problems?
No.
Any dysphagia?
No.
Dyspepsia?
No.
Do you have a history of any ulcers?
No.
Okay. Do you have any coldness or numbness in your feet, your calves, or your legs?
No.
Okay. Any numbness or redness or tenderness in your bilateral lower extremities?
Nope.
Do you feel like your extremities have like a sudden hair loss?
No.
Okay. Any color change in your fingers or your toes with the cold temperature?
Nope.
Okay. Any frequency with your urination?
No.
Any incontinence?
Nope.
Hematuria?
No.
Urgency?
No.
Do you wake up in the middle of the night dying to pee?
No.
Okay. Any renal stones?
No.
Okay. When was your last pap smear?
Last year?
Okay. Did they give you a pelvic exam at the same time?
Yes.
Okay. Any vaginal discharge that you've noticed?
No.
Any history of STDs?
No.
Or pregnancies?
No.
Okay. Do you have a history of seizures?
No.
Okay. Any weakness that you've noticed?
Nope.
Any numbness or tingling in your extremities?
No.
Okay. Do you have any back, limb, or neck pain?
No.
Okay. Any decrease in range of motion that you've noticed?
No.
Any stiffness in your joints when you walk or move around?
No.
Okay. Are you anemic?
No.
Do you have any clotting disorders?
No.
Have you ever received a transfusion?
Never.
Okay, so you've never had a transfusion reaction, obviously. Okay. Any increase in urination or thirst?
No.
Have you ever experienced heat or cold intolerances where you just couldn't be in that specific temperature?
Nope.
Any hair, nail, or skin changes?
No.
Okay. And are you celibate or are you sexually active?
I am celibate.
Okay. So your number of partners is 0 at the moment?
Correct.
Okay, but if you were to take part in that, do you prefer homosexual or heterosexual partners?
Heterosexual.
Okay. And then you have no history of STDs, like you said.
Correct.
Okay. Have you ever been diagnosed with a psychiatric disorder?
I have not.
Do you experience mood swings at all?
No.
Okay. And do you experience hallucinations or delusions?
No.
Okay. Awesome. So that just completes the questions. I just wanted to get a general idea of where you stood. And then now I'm just going to do a physical assessment, is what you're here for head to toe. I'm going to wash and sanitize my hands. Okay. I'm going to take a quick set of vital signs for you.
Okay.
And then how tall are you?
I am 5'11".
And then what weight would you say?
230.
Okay. Okay, let's take that blood pressure real quick. All right. 130 over 62. Very good. Okay, I'm just going to take a general look at you, at your general appearance. Just kind of make sure that you have bilateral muscle mass all throughout. Your skin is intact and everything like that. I'm just going to check your face for proper configuration. There's no deformities or anything like that. Just going to check your hair to make sure there's no critters, there's no dandruff. Assess your skull. You've never had any trauma to it, so your skull overall is intact. I'm just going to check your face. I'm going to ask you to smile and frown and kind of puff up your face. Okay, and that's just checking your cranial nerves to make sure that that's all intact. As far as that, we're going to do like the sharp and dull test around your face. So this is dull and this is sharp. And I'll be doing that across your face, so I'm going to have your eyes closed and tell me whether it's sharp or dull.
Okay. Dull. Dull. Sharp. 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 Dull.
Okay, very good. Okay, and as far as your eyes, I'm going to have you read the Snellen chart with an arm's length apart and just read the lowest line that you possibly can, covering one eye. And then we'll do the same thing for your other eye.
Okay. LTFPH.
Okay, perfect.
LTFPH.
Okay. I am going to take a look at your external ocular structures. So just look right at me. Okay. Perfect. Okay. And next I'm going to have you follow my finger with your eyes. I'm going to be going in a certain direction, so just follow the tip of my finger. Okay. Very good. I'm going to be checking your peripheral vision, so I'm going to kind of put my hands behind you, and when you see my fingers wiggle, you let me know when you see them, okay? So just look straight ahead, right at my necklace.
See him.
Okay.
See him.
Okay.
See him.
Okay. Very good. So I checked your external ocular structures. I checked your internal ocular structures. Your ears. I'm going to be checking your external ear structures. I'm just going to move your hair. Checking your mastoid process. Okay. I'm going to have you kind of face that way, and I'm going to stand behind you.
You need me to stand?
No, you can
Okay.
sit. And then I'm going to whisper. I'm going to have you cover one ear. Same thing with like we did with your eyes, and just say back the words that I'm saying. So, yep.
Dog. Cat. Horse.
Okay. Same thing with this ear.
Pig. Pug. Refrigerator.
Okay. Awesome. And then next I'm going to be doing the Weber test. So I'm going to use my tuning fork and I'm going to slap it on my hand and I want you to tell me if you hear the ringing in both ears.
Okay. Yes.
Okay. Then I'm going to do the rind test, which is pretty similar. I'm going to first put it behind your bone right here, and then I'm going to put it around your ear, and you just tell me which one you hear longer. Okay? And tell me when you don't hear the sound anymore.
Okay. Okay.
Okay. Which is good. Your time with your air conduction is longer than your bone conduction, which is good. We'll do the same thing for this ear.
Okay. Okay.
Okay. So she passed both of the ear exams, which is good. Okay. I'm just going to look at your nose just to make sure that you don't have any deviated septums or anything like that. I'm palpating her maxillary and her frontal sinuses. I'm just going to use my light to look at her her septum and her turbinates. Okay. And her mucosa is red and moist and normal. Okay. Can you open up your mouth for me? Okay, let's see if I can flash a light in there. Okay, can you say ow for me? Okay, so move your tongue around for me, up and down. Okay, good. So I want you to use your tongue to push my hand against your cheek. Okay, same thing on this side. Okay. Now I'm going to be assessing your TMJ, so I'll be feeling right in the back of your mouth, and I'll just ask you to swallow, okay? Okay. No issues there. Okay. And then I'm going to be listening to your carotid. I'm going to just feel for your carotids first. Okay. Good. Can you move your head side to side, up and down, and then kind of ear to ear? Okay, and I'll do the same thing, but I will be resisting you, so just try to push your hands away. So if you can, perfect. So push, okay, perfect. I'll be checking for her thyroid. I can see it. And go ahead and swallow for me. Okay. Okay. And I'm just going to listen to your carotids. Take a deep breath. Okay. So for this part, I just want to ask you to take your shirt off so I can just see your chest. You can do it from the top is fine, whatever you want. Yeah. Okay, I just want to look at your chest to make sure that it's symmetrical. Just palpating. Make sure that it's symmetrical and bilateral when you take a deep breath. Okay. Okay. I'm just going to be percussing across your chest to make sure, just around along your lung lobes. Okay. And I'll be doing the same thing for your front and your back. I'm just going to listen to your lung lobes now and your lateral thorax. I'll be doing this side to side, okay? Just perfect. All right. And the same thing for your back. I'm just going to have you turn. Just move your hair. Okay, so I'm just inspecting. Okay. Okay, I'm just palpating. Okay. Palpating your flanks in the back too. Same thing, I'm just going to be percussing. And then in your flanks. Okay. Just going to be listening as well. Okay. And I am going to measure your tactile ephemeris. So every time you hear me put, or you feel me put my hands on your back, just say the words 99, okay?
99, 99, 99.
Okay. I'm going to do the same thing for the front. Just to measure any crepitus.
99, 99, 99.
Okay. No crepitus noted. Okay. I have measured that her AP diameter is about 1 to 2. As far as your heart, I'm just going to inspect for any contusions or anything like that. I'm palpating the PMI for any heaves or thrills or palpitations like that. And I don't feel anything. So I'm going to be listening to your heart in 3 different positions. The first one is the one that you're in right now. I'll be using my bell and diaphragm to listen to all your points. Same thing with the bell. Go backwards. Okay. And I'm going to be doing the same exact thing, and then I'm just going to have you lay down like supine. Okay. So same thing with the bell and the diaphragm. Okay. And the next position, I'm going to have you lay on your left side. So you might want to put your head, yeah. Yeah, perfect. So stay on that left side for me. And same thing, bell and diaphragm. I'm going to sneak right here. Okay, perfect. Go ahead and sit up. Okay. So I'm just going to assess your abdomen. You can put it back on and I'll just lift your shirt up. So I'm just assessing your abdomen. going to be listening to all 4 of your quadrants. Definitely got some hypoactive gastric sounds here, okay, which is really, really good. I'm going to percuss your abdomen, same thing, all 4 quadrants. No, that's not what I want to do. Yeah, I do. Let's palpate your abdomen. I want to palpate your liver as well and measure your liver span, which is about 7 centimeters, your abdominal aorta, your renal arteries, your iliac arteries, and your femoral arteries. I'm going to be palpating you. The first time is going to be light palpation. If you feel any pain, let me know. Okay. And then for deep palpation, it's the same exact things, but I'm just going to have you lay down with your legs, your knees up.
Okay. This.
Perfect. If you feel any pain, let me know. Okay. Very good. Okay. Okay, you can go ahead and sit up. Okay. I'm just going to take a look at your nails for your peripheral vascular. Okay. Just measure your cap refill for each finger. Okay, I'm going to do the same thing for your toes. Just take a look at them. And then just check for cap refill. Looks like she has no issues with her cap refill. Just going to take a look at your muscle mass. Just the same thing I did before to make sure your skin is appropriate. There's no bruising. There's no bleeding. Okay. So I want you to take your fingers and put them out. And just kind of open them, close them, open them, close them. Okay. I'm going to do the same thing with resistance. So I'm going to try to spread your fingers apart and just try to squeeze my fingers in. Okay, and the same thing. Perfect. And as far as your wrists, kind of rotating them in, rotating them out. Try to go alternate. So put your hand in face and just try to stop me from moving it. Okay, same thing. For your elbows, kind of up, down, out. Okay. Stop me from moving your elbows out. Okay. And then for your shoulders, kind of hands up, hands down, out, in. Can you shrug your shoulders for me, up and down? And try to stop me from putting your shoulders up. Okay, pushing them down. Okay. Okay. I'm going to feel your radial pulses. I'll sit right next to you. Feel your ulnar pulses. Your brachial pulse. Okay. And kind of feel, I felt your femoral pulse. I'm going to go to the back of your knee, popliteal. Your dorsal pedis pulse. And your posterior tibialis pulse. Okay. I'm going to just check your hip function. I know it's a lot of moving up and down, so just go ahead and lay down for me. And just kind of lift your leg up to my hand, down. Same thing with the other, up, down. Kind of see if you can cross your leg over your other leg. Same thing. Okay, perfect. So go ahead and sit up.
Get my workout in
I
today.
know. All right, see if you can push my hands in together with your knees as I'm putting them apart, and try to stop me from putting your knees together. Okay. I'm going to do the same thing with your ankles. Try to see if you can stop me from putting your ankles in. Okay. Can you put your toes up, put them down? Okay. Which is really good. Okay. Okay. So the same thing like we did with your face, we're going to do the same dull and sharp. So this is dull, and this is sharp, and I'm going to just be doing that throughout your body.
Okay.
So go ahead and close your eyes and tell me whether you feel dull or sharp.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Okay. Really good. Okay. So I'm going to slap this on my hand, and I want you to tell me if you feel the vibrations at the end of your extremities. Okay. I'm going to do the same thing for your fingers and your toes. Okay. 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 I want you to touch your nose and then touch the tip of my finger, and I'll be changing the position of my finger. Okay.
Okay.
Mm-hmm. Keep going. Okay. Awesome. Can I have your finger? Thank you. So I'm going to tell you this is up, and then this is down. So when you close your eyes, tell me in which direction I move your finger. Okay?
Down. Up. Up. Down. Down.
Okay. Do the same exact thing with your toes. Okay?
Up. Up. Down. Down. Up.
Okay. Very good. Okay. I'm going to check your Babinski reflex, so I'm going to have to borrow your foot for me. Thank you. So I'm just going to take this and slide it down your foot. Okay. And tell me if you feel these points, okay?
Yes. 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 Yes.
Okay. All right. I'm going to have you stand up.
Okay.
Okay. And for your spine, I'm just going to ask you to kind of bend forward.
Okay. You want me to, which way would you want me to face?
Anywhere. Yeah, bend forward. Bend backwards. Kind of side to side. Okay. So I want you to kind of go to that end of that couch and kind of walk towards me. Just I'm assessing your gait.
Okay.
Yeah. And I'll walk back with your on your tippy toes. And then walk back one more time on your heels. Okay. Awesome. So we're just going to go in front of this camera. And I'm just going to have you close your eyes.
Okay.
All right. So I'm testing her Romberg test. And she's not swaying, so it looks like she has a positive Romberg, which is good. And while you're standing, I'm just going to take a look at your back to assess your spine. And I'm just palpating. I'm palpating your flanks as well. Okay. I'm going to say 3 words to you, and I want you to remember them and state them back to me when I ask you.
Okay.
Computer, dog, cat.
Okay.
Just remember those. Okay, you can go ahead and sit. All right. Can you tell me what your name is?
Katrina.
Can you tell me what today is?
Today is December 3rd,
Okay,
2018.
Good. Good. Can you tell me what you ate for breakfast today?
I had a protein shake.
Okay. And tell me your brother's birthday.
February 4th,
What year?
1992.
Okay, good. Can you count back from 100 by 4s?
96, 92, 88, 84, 80,
Okay, good.
76.
No, very good. How would you interpret the saying, don't put all your eggs in one basket?
It means don't put all your hopes into one thing. You know, don't get so caught up on one thing that you forget other things.
Okay. And then what were the 3 words that I told you earlier?
Computer, dog, cat.
Okay, very good. Do you have any questions for me?
I don't.
Okay, well, thank you for participating.
Thank you.
Okay.